Good evening, everyone. Thanks for joining us. We'll just wait a couple of minutes for everyone to get online and then make a start. Okay, thanks everyone for joining us. My name's Tegan and I'm the project manager of StockSense. Tonight we have Dr. Rob Bonanno with us speaking about all things calving. So that's looking to be a great presentation. Just a short intro from me. As I said, I'm project manager of StockSense. We are a project which is actually funded by the Cattle and Sheep and Goat Compensation Funds and delivered by the VFF. So our main goal is to help Victorian livestock producers and raise awareness around improved animal health, welfare, and in particular biosecurity, which is a hot topic at the moment. So we run a number of educational workshops across the state, as well as our webinars. And we've got a number of fact sheets and resources on our website. Just head to the VFF page or StockSense page and you'll find those. We've also got a quarterly newsletter which we send out and you can sign up to that via our website as well. So these are our main reasons for wanting to maintain and raise awareness around livestock health, welfare and biosecurity. It really is a consumer-driven industry, as well as, consumer expectations around animal welfare, and that leads into the market access side of things. You should have received a link to our pre-webinar survey via your email when you registered. If not, I'll give you a couple of moments if you have your phone handy just to scan the QR code here and fill in just a 30-second feedback form would be great. This project is producer driven, so we really value your feedback and it helps us to continue the project and maintain the funding going forward. So just while you're doing that, we've got a couple more webinars coming up next month around goats. So that will have the couple of goat vets speaking on goat health and biosecurity in Victoria. Okay, I'll move on. That's where you can find our website and our social media. Please follow us if you like, and our email is there as well. If you have any questions after this, feel free to get in touch with us and we can pass any questions on to Rob. So with that, I will stop sharing and pass over to Rob to share your presentation. Thanks, Rob.
Okay, can you see that and hear me?
Yes, all good.
Fantastic. Okay, I just need to make sure that I can see what I'm doing and do that. And I would just thank everybody for joining. It's a real pleasure to actually have the opportunity to present tonight to you all. Just going to do a little bit of a talk tonight about realistically calving and what happens around the process of calving. Some of the things that are important. I want to progress. We practiced and it worked fine. And then just once we go through with the slides, we'll at the end we'll hopefully have some time for some questions. Let me just stop that. I'm going to start again because it doesn't seem to want to work. I'm going to go share the screen. Try that one. That might be better. Can you see that now?
Yep.
Great. Okay. So I think that one of the things that I'd like to, just say to the people listening here in tonight is that around calving time, how you manage your stock can not only affect the viability of the calves, but it will also affect the profitability of your enterprise. And that if we're on the spot and able to provide good supervision and timely assistance around calving, we will save lives. So just a little overview of what we're going to talk about tonight. We're going to talk firstly about preparing for calving. Secondly, we're going to go through the stages of labour, just so you know what you're looking for. And then we're going to go around prevention of calving problems, assisting with calving problems, and then a touch on the end about talking about caring for the newborn calf. So this is a busy slide talking about the nutrition of the herd, but really what I want the message to be for people to take away from this slide is that managing I suppose the nutrition of the calving cows, making sure they're in the right body condition, and making sure that you've got good records of when the cows are due to calve will help you to start sort of feeding them up, get them ready to calve. And if you've got a good program of transition and management around that sort of critical 3 weeks before and 3 weeks after calving, you will actually see a much improved outcome for your calves. And especially if you're going to use hay feeding, because you might be going to calve them in either a calving paddock or a calving pad, it's really important to make sure that you've got that hay procured and stashed away so that you've got it available for you, because there's nothing worse than when we get called out as vets to calving cows where the farmers run out of feed and the cows are starting to shed body condition, so they're going backwards in body condition and they just simply are too weak to progress their calving. In this lead up to the calving time, now is the time to restock your calving kit. There's a list here of what I consider, to be useful things to have in your calving kit. And I really like when farms actually are prepared and have made sure that they've got this stuff available for them. I tend, as a vet, to use chains. And the reason why I tend to use chains is because I find them easier to disinfect between calves and between jobs. But on farms where people are using calving ropes or calving straps, I don't have a problem with that, providing you've got a way of disinfecting those, chains or ropes or straps between each job that you do. I like for people to have a calving jack or a calving pulley, but I also like people to be skilled and trained in the use of that. There's no point having a calving jack and thinking that you're going to jack every calf out. There is actually skill required in managing those calving jacks. And so I do think it's important that you have some training in using it. Gloves and lube. I wear gloves when I deliver calves. There are some diseases called zoonotic diseases, things like leptospirosis and Q fever, that you can catch from helping assist the cow to calve, as well as if we've got gloves on, we tend to be less likely to contaminate the birth canal of the cow, which is much better for her. You can buy calf resuscitators, little things that you push on to help to keep, some air blowing into their lungs. But often I just use a towel and I stimulate their nose. In my calf kit, I like to have my tags, whether it be the ID tags for the management or whether it be my NLS tags or both. I do think it's useful. And some kind of a nasal spray and something to sort of warm them up and keep them warm if we can. I also, at this time of year, like farms to actually think about what's in my sick calf kit. Have I got some gloves and some aprons and I've got something that I can handle sick calves with, as I said, firstly, reducing the risk to us of zoonotic disease, but secondly, reducing the risk of spreading disease from one infected calf to another. So again, when we're talking about sick calves, some of the diseases that they can get that we can catch include things like salmonella and crypto or cryptosporidium. And so having gloves and aprons and stuff so that you can do it in a clean and hygienic way is important. Making sure that if you're going to be feeding calves, that you're able to disinfect the bottles, the teats, whatever you're using. And if you're going to be tube feeding calves, it's a really good skill to have And if you can't tube feed a calf, it's definitely worth talking to your vet and asking them to give you some training and some support in learning how to do it. There are a couple of tricks, but not the least of which is making sure that you go down the right hole when you're putting the tube in, because if you don't, it ends badly. When we're talking about electrolytes for calves, I always try and encourage people now to have what we call zero bicarb electrolytes. The reason why I prefer them to have zero bicarb electrolytes is that it doesn't interfere with the clotting of the milk in the stomach, and it also doesn't alkalinize the gut, which can help bacteria to survive in the gut. And that's important, particularly for people that are rearing beef calves that are running on their mum, because we don't know when they last fed and we don't know when they're next going to fed. Whereas if they're dairy calves or calves being reared off the mum in a shed or in a pen, we can use electrolytes that have got bicarb in them, providing we sort of separate those bicarb electrolytes by about 2 hours from a milk feeding. In my sick calf kit, I like to have a thermometer. It astonishes me how many people you say, "Oh, has the calf got a temperature?" And they go, "I don't have a thermometer." Just get one. They're cheap, they're effective, and they can help you to decide whether a calf's sick and whether it might need antibiotics and or anti-inflammatories. I always like to have some sample pots so that you can collect a good poo sample, which we can use for testing, and also some warm coats and plenty of syringes and needles. If we're going to put calves in a shed, now is the time to clean it out and make sure that we've got good fresh bedding in there, and we're going to put them in an area that's not got infection carried over from last season to this season. For the calves that are running out, on the cows, that's not an issue, but it is something to consider when we talk about the calving area or the calving paddock where those cows will be calving in. I do think that if people are going to be rearing calves on buckets or in pens, that the one secret to success is hygiene. If you can have a nice clean environment for those calves to come into, they've got a much better chance of a successful outcome. I've written up at the top here about calving records or accurate records to decide which cows or which heifers are due to calve. For our dairy farms, that's actually not too difficult, because a lot of the time there's AI bred, and a lot of the time we've got a breeding date, we've got a confirmed pregnancy from a pregnancy test, and so we can tell plus or minus sort of 7 or 8 days when a cow is expected to calve, and so we can actually get them in and start really supervising them carefully, and lead feeding them and getting them prepared prior to them actually getting to that critical point of calving. The other thing that I encourage people to do at this time of year, just as they're leading up to calving, is to give your crush a good service. Clean out the area around your crush. Get rid of all the trash that's accumulated there over the season. We don't need old tags and daggy tails and all that crap sort of sitting around the calf area where you're going to potentially be pulling newborn calves and dragging them out. Get your calf crush clean. Get the area around it tidied up. Fix any broken gates or broken latches, and make sure that your crush is safe to work in, because it's our workplace as vets, but it also is your responsibility as a herd owner and an animal custodian to make sure that you do have the ability to safely handle cows. It astonishes me how often as a vet I get called out and asked or expected to try and pull a calf behind a gate or tied to a post. I was talking to a friend and colleague who was telling me that they had a cow tied to a windmill in a lightning storm that they were asked to pull a calf out of not that long ago. And I just think these things are unacceptable in the ages that we work now, where work health and safety has to be a huge consideration as to what we're doing. Vaccinations around this time is an important thing to consider. If you've had problems in the previous years with sick calves, if you've had issues that have been diagnosed where a vaccination might be preventative, now is the time to make sure your herd is up to date with all their boosters. If nothing else, make sure that your herd is vaccinated with 7-in-1 for lepto prior to assisting any calvings, so that you reduce the risk of spreading that infection to yourselves or anybody helping you. And if you've brought in new animals or you've got new heifers coming through, make sure that they've had both their doses of vaccine if you are using a vaccine program. Because we talk about strategically vaccinating the mums to try and boost the colostrum, which is the first milk that the calf drinks. And if that colostrum is high quality with lots of antibodies in it, those calves have a better start to life. They're more productive, they have faster growth rates, and they have much, much lower risk of sickness and death. And so getting that early management of the calves right is critically important. So I've got a bit of a few sort of rough rules that I sort of say, if you've got more than 10% of your calves that you're treating, or more than 3% of your calves dying from a problem during a season, and you've been able to confirm what the pathogen is, and that does require usually a vet visit or at least a sample being taken into the clinic to be analysed. If we know what we're dealing with, we can put in place some preventative strategies. And in my day job, I work with a company called Apium. We do Pro Dairy, which is our proactive or progressive health, and we actually work to try and prevent diseases rather than treat them. And I do think that goes across the board. If we can prevent problems, we're always better off. But it does, again, rely on some vaccination records. If I'm talking about the colostrum vaccines, they only work if the calves get enough antibodies from their mum. And so if you've got a calf that was a difficult birth, or if you had a calf that was, the cow had big bodily teats, or the calf was, got swollen tongue, or not being a bright and vibrant calf that's leapt up to its feet and, gone after a first feed, you can have spent all this good money on vaccines, but if the calf doesn't get the colostrum, it won't actually get the benefit. So it is important that if you are vaccinating, that the calves get the colostrum, and if they miss out, then there are some ways that we can ensure that they get colostrum by either milking some milk out of the cow. Do that at your peril if she's a crazy beef cow. But if you've also got a ability to collect some milk from one of that first milking from a cow, you can store it by freezing it for a later date if you've got a calf that misses out. The other good thing about vaccinating the cows, is that even though they can only absorb the antibodies intact in that first 24 hours, just having the antibodies present in that milk that the cow's producing will help to provide some protection against particularly viral scours in those first critical few days. We talk about the reason why we need to give first and second vaccines, because we get a little blip of immunity, and then when we give the second booster, we get a much stronger and longer immunity. And if we time that correctly, that happens around about the time when the cow starts to produce her colostrum, which she starts about 5 or 6 weeks before she calves and produces colostrum right up until the point where she does calve. So if we can time our vaccines right, and that's why now is important, if we're going to vaccinate, it's the right time to do it. Moving along, because we've got a bit to get through and not a lot of time, we're going to talk about the stages of labour. And I think it's important that we understand that what are the signs that a cow is either calving or about to calve. So there are some behavioural changes in the stages of labour, and usually the first one we'll notice is the cow is maybe a little restless, and she might even go and isolate herself, go off into a quiet corner under some trees, find a quiet spot away where she might start her process of labour. Physically, we'll notice that she starts to develop an udder. We call that bagging up. Sometimes they'll even leak milk, which is a sign that calving is impending, but it also is a sign that they're leaking out that important colostrum. So be aware that if a cow is leaking a lot of milk pre-calving, that the quality of her colostrum might be not as good as we would hope. You'll also see some swelling of the vulva and softening, and that softening of the ligaments where the tail starts to seem to sink because the ligaments are starting to relax, getting that cow ready to calve, are good signs that, good physical signs that she's about to calve. But it can be tricky because we'll see heifers bag up and develop an udder and start to soften 6, 8, 10 days before they're due to calve. And it really is difficult to plan our intervention if we've got no idea when they're due to calve. Hence the reason why I was saying having some records about early preg tests or mating or calving dates is really beneficial if you can do that. So we break labour down into sort of 3 stages. Stage 1 it's up to 12 hours in heifers. And so sometimes we've got to be a little bit careful that we don't jump the gun. But it's the stage that we're looking at where the cow will separate herself off. She'll lift the tail. She'll start maybe swishing the tail, like she starts to get a bit agitated or anxious. She may even sort of kick at the belly or roll around on the ground or get up and down. And then last but not least, you usually see the little water bag. And that water bag is a definite sign that she's in stage 1 labour and that she needs to be more carefully observed, because if she doesn't progress, then that could be an indication that there's some problems. So I normally would recommend that if a cow has been in stage 1 labour for at least 6 hours and you've seen nothing happening, no progression, she's up and down, she's off from the herd, it's definitely worth considering getting her in and examining her. And here's a picture we've got of a cow just with that little water bag hanging out. And she's a dairy heifer on a calving paddock. And so she's closely observed once she gets to that stage. The second stage of labour is actually the delivery. It's when the cervix is fully dilated and the cow is ready to actually deliver the calf. She'll start to strain, and we'll see her pushing, and then you might start to see the feet, and then the feet and the nose, and then the feet and the nose and the eyes. And that is what we would consider to be good progression. And once the water bag breaks and the calf starts to be delivered, we're wanting to see that gentle, slow progression. And slow progress is normal progress. And it's only really when you get a stagnation of that delivery process where you've gone for a period of time, normally I would say 20 minutes, where you're seeing just no improvement, no movement, and you're seeing feet and nose and nothing else. And that's when you need to consider to examine, especially if there's nothing happened after 2 hours of her starting to labour. If she's still not delivered the calf in that time, then we probably want to at least consider having a good look at her. If you go too early, particularly in heifers, if they're not relaxed enough and they're not well into that calving process, we can actually make the problem worse, not better, by damaging them or traumatizing their birth canal. And so it does take a little bit of experience and a bit of knowledge to understand when the ideal time is. But realistically, we want to see this progression to the point where the cow is, sort of pushing the calf out, and she's going to deliver that calf all by herself because the hips are just sort of past the point where they would block her off. The last stage of labour, probably isn't as important as the first two, but it's the expulsion of the membranes. It's when they actually push the rest of the placenta out, and if it's uncomplicated, they'll expel the membranes within a couple of hours of calving. If they keep them within more than a few hours, more than say 12 to 24 hours, we would consider that to be a retained afterbirth. And she may or may not need treatment depending on whether she becomes unwell. Now I was going to move along, as I say, keeping it going along at a reasonable clip, just to make sure that we get through everything. Talking about preventing or managing, dystocia. How can we prevent cows from having calving problems? Dystocia is kind of like the sciencey word, the vet word for difficult birth. And so, we call it calving problems, dystocia, whatever you want to call it. It basically is where the birth is complicated because it's not straightforward. The cow doesn't deliver and progress to deliver the calf on her own. And we often will, in that case, need to assist them. A lot of the people say to me, but why did she have problems? And you know what? There's a whole bunch of reasons. Fat cows. We can have skinny cows. If we've got, if you've got a big calf or a small cow, that can be the reason why they're not having a thing. If the cow is really weak and she's not able to contract, usually because she's in a negative energy balance, she's not got enough food and she's going backwards in her body condition, she may not have the strength to push the calf out. And then there can be the things that are beyond our control, things like twisted uteruses, where the cow is straining, the calf can't come because the uterus has been twisted. And then last but not least, and probably the most common reason why we'll end up being, as a vet involved in delivering the calves is because there's an abnormal presentation. The calf comes, with the legs not quite right or the head back or something like that. And when we think about this, the ones that we can control really are the body condition, the size of the calf and or the size of the mother, and whether the cow is in good enough body condition to actually, push that calf out and deliver it. We can't necessarily stop twisted uteruses, and we can't change the cards the way they've been dealt to us if the calf decides to come, abnormally and not presented correctly. But what we can do is control the things that we can control. And so, I look at it and I say, if a cow is very fat or very thin, she's going to have more trouble. So what I want to aim for is a moderate body condition. I want, in a dairy cow out of 8, I want her a 4.5 to 5.5, depending on the score, the system you're using in your beef cows out of 9. You want her around about that 5.5, just so that she's the Goldilocks, not too fat, not too thin, just right. If you can get your cows to calve in a good body condition, not only does it mean that they won't be too weak to calve or too fat to push, but it also means that those cows are much more likely to recycle early because they've not come in weak or low in calcium or whatever. They're just strong, robust cows that calve without too much difficulty, clean, pass their membranes and get on with life. And those are the ones that become your profitable cows. The stature or the size of the mother. This is one of the most common reasons why I see bad calving problems in, generally speaking, hobby beef enterprises, or in situations where the season's gone against us and the feed has run out. And we've got these small, poorly grown heifers that have gotten pregnant because they finally reached an age and a weight where they can cycle, but their structure hasn't developed. And so they're not big enough in the pelvis to deliver a decent sized calf. We look at our aim is to have our heifers calve at around 90 to 95% of the mature body weight of the cows. So in a herd where the average cow is 600 kilos, we want them 550 to 570 kilos at calving age. And that is a pretty big ask. And I would question how many heifers actually achieve this on your farm, because if you're getting a lot of calving difficulties or stillbirths or problems delivering calves in your heifers, then it could simply be that the rearing and the nutrition of your heifers hasn't been adequate to actually grow their structure and their frame to make them, able to easily deliver a nice, big, robust calf. The next thing that we can control is how big the calf's going to be. And so if we have a really large calf, it doesn't matter how good or big the cow is. If it's a super large calf, she's going to have trouble. And so the disproportionately large calf will increase the risk of dystocia. Selecting what bull to put over your animals is also a good decision. There are some very big, very muscular bulls around with high growth rates and all sorts of cool traits that we're trying to breed for. But if you don't have the right breed or size of animal to put those bulls over, a bull that can be a great selection on one farm can be a dreadful selection on another one. So being careful to select the sire that is appropriate for your size cows to deliver the size calves that you want. And with AI, we have the ability to select, low birth weight, short gestation length bulls. And so, using those bulls and managing the transition of the cows well is, I think, a really good strategy. When we buy bulls, to paddock mate or naturally mate with cows or heifers, we are a little bit up in the air unless the bull comes with some figures, and then being able to interpret those results and those numbers and say this bull is an appropriate bull to put over my heifers because he's short gestation or low birth weight with good or moderate growth, post birth. That's the sort of bull we're looking for. The way we manage and feed the cows at around the point of calving can really make a big difference. If you get cows, one of our vets was out today, actually, just this afternoon, treating a group of beef, mums that were down with milk fever just at the point of calving. Those cows are going to struggle to come back and cycle, to deliver a good, healthy calf. And those cows will have an increased risk of what we call the transition diseases, things like retained afterbirths, milk fevers, and those types of problems. And so feeding the cows really well in that last few weeks before they calve is a really good strategy for managing calving risk. And your vet or your nutritionist or various consultants can help you with those, because it really isn't a one size fits all. And I think that using somebody to give you some advice is highly recommended. Now the bit that everybody came for, assisting with the dystocias. How do we identify what the problem is, and how do we apply what I refer to as the 20-minute rule? This next slide hasn't transferred well from a poster to a PowerPoint, so I apologise for that. But basically, it's showing us some of the numerous presentations that we can come across. And as a vet, I've seen all of these and more. Up the top here in the top left-hand corner, we've got what we call a normal presentation. That's the calf that's just simply diving out of the cow, presented front wave, front feet, nose over the feet, coming out. And I say they literally dive out of the cow, and that's how nature was intended for them to come. But we do see a proportion of the calves that just come backwards, but they will come and often calve moderately easily if the calf is not too big a size, even coming backwards like that. Transverse presentations where we've just got a bunch of legs coming at us, they are very difficult for people to often sort out. And often I'll get called out and people say to me, oh, she's got twins. And the reason why she's got twins is they can feel more than 2 feet, 3 or 4 feet they can feel. And so sometimes it's twins and sometimes it's one of these transverse presentations that, where they're coming all 4 legs or, coming at you at once. These back first presentations, they're a nightmare. There's nothing to grab hold of and there's nothing to work with. And so I find them challenging, and often they end up, cesareans if the calf, is valuable enough and the cow's valuable enough. These head back presentations or head down presentations can be really challenging. And that's why, and as we go through the process, I'll talk to you a little bit about head snares and head ropes. They can be a very valuable tool in assisting with these, but they are often jobs that farmers find difficult and need to call the vets out, because if you're trying to correct a malpresentation and the cow is straining hard against you, sometimes being able to give them an epidural up in the tail space up here just to stop them from straining will allow us to correct those presentations. These legs back, twisted carcasses, hips, back, whatever, they happen and they are challenging, and each one is different. And it really depends on the size of the animal as to how difficult or otherwise that might be to correct that and present it. So the big question, the number one question that people often ask me, when do I intervene? How do I know that I should either get involved myself or get somebody else involved? And I say that realistically, if they're not progressing from stage 1 to stage 2, so they're just fiddling around, they're not getting to the point where they are presenting a water bag that bursts and then they progress, we should get them in and check them. If they've been actively labouring for, say 2 hours, but sometimes even less, depending, if you see a malpresentation, if there's only 1 foot out or there's 2 feet and no head, you know that you don't wait the 2 hours, you get onto it more early. So that obvious malpresentation or distress from either the mum or the calf is a really good sign that you should intervene. And how much you intervene and what you do depends on a couple of things, not the least of which is A, how skilled you are, but B, if you have the facilities to safely examine the animal. Every single year we hear of people injured, sometimes fatally, trying to get cows in to calve them, because those cows at that point of calving can be a little bit crazy at times. And if you don't have a good facility where you can safely restrain them, then that is something that you should really give a lot of thought to as to whether you should or shouldn't be intervening with those cows. So as I said earlier, I want my calving box to be well stocked so that I know where it is and I don't have to go looking for everything, because there's nothing worse than it being late in the evening and not being able to find what I need. We need a crush that's fit for purpose. I like 2 buckets of clean warm water. And the reason why I say that is because one to work in and one to wash up in. But also if things get really dirty, you can actually swap buckets halfway through. And I do think that it's really important that hygiene is top of mind. And the reason why that is because every time we put our arms inside a cow, we're running the risk of introducing germs. If we're pushing lots of dirt and grit in there as well, that will not only increase the likelihood of an infection, but the trauma from that grit and dirt going into the cows will damage the sensitive and reproductive tract, and can also cause long-term infertility. And so hygiene, they say cleanliness is next to godliness. 100% agree. If I'm going to pull a calf, I've been doing it a long time now, and I can actually tell you that usually I can tell within 30 seconds to a minute whether this is going to be an easy calving or a difficult calving. And I sort of say to people, use as a rough general rule, if the calf's coming forward, if you can get the hand over the head and or beside the head, as you pull the calf up into the pelvis, you can actually usually think, yep, if I can get my hand over the head and around the side, then there's going to be enough room to deliver that calf. And if I pull the calf up by my hand strength, I'm not hooking onto the jack at this stage. If I just pull the legs up and I can get the fetlocks, which is the first bendy joint, a hand span past the fetlock out of the cow, I'm pretty confident I'm going to get that calf out. If the legs are crossed and as I pull them, they want to cross more, that's telling me the shoulders are engaging and not sliding through. So if I've got no room beside the head and crossed front legs, I know that it's going to be potentially quite a difficult calving. And if you're not experienced, that might be the time right then and there to seek some assistance from somebody more skilled. If the calf's coming backwards, you want to be able to pull the calf up again just with the strength of your arm and fit the calf, put your hand over the pelvis of the calf while it's inside the cow. If you can do that, there's enough room to slide your hand over the pelvis while you've pulled it up into the birth canal, you've got a pretty good chance of pulling that calf. And if when you pull on those back legs, you can get the hock, which is the pointy bit of the back leg, so not the flexi joint, the pointy bit, if you can get that past the vulva, or at least to the level of the outside of the cow, you can almost certainly pull that calf. And so again, if you can't do one of those two things with a backwards coming calf, depending on your level of experience, now might be the time to seek some assistance. So this one is one of my most favourite little posters that we put up in some of the dairy farms that I work in. How do you know if it's a front leg or a back leg? And this is the secret. A front leg has 2 bendy joints before you get to the pointy bit. The back leg has only 1 bendy joint before you get to the pointy bit. So if you've got 2 flexi bits and then a pointy bit, you know you're working with a front leg. And so when I go out to get some of those calves that have got 4 legs, presenting, I'll go out and the farmer will have been pulling on a front leg and a back leg. And they say, how can you tell the difference? That's how you can tell the difference. One flexi bit is a back leg, 2 flexi bits is a front leg. And I do think that's a really important, and if you learn nothing else tonight, that's one of the most useful things you'll probably pick up. When I'm putting chains on, I really do think it's important that we get above that front leg, above the fetlock joint or the first bending joint. The reason being is if we pull all our weight from below that joint, we will do damage to the calf and you could fracture the leg. I tend to put 1 loop above and 1 loop below so that as I pull, and I put my chains across the top of the foot so that when I pull, the stretch tends to flex the foot upwards. By flexing the foot upwards, it stops it from digging into the vagina of the cow and damaging her. And I do think that that's, again, another little tip that I can pass along. One of the most underutilized tools in delivering calves is a head snare, especially if the calf's quite large and it's a tight but not impossible pull. The reason being is that a lot of the time, if it's quite a tight pull, and even if the calf's presenting normally, it's diving out, front feet, head's there. As we pull on the legs, the head tends to push back. It doesn't want to keep coming forward because it's a tight squeeze over the pole. So if we can get a rope around behind the ears and into the mouth, we can actually put traction on the head either at the same time or as independently to when we're pulling on the legs. And so I like it to go around behind the ears and into the mouth. Some people use eye hooks. I'm not a fan of using eye hooks, A, with inexperienced people, or B, in live calves, because they can do some damage. But eye hooks, which actually just hook into the orbits of the eye, can be a useful a tool. And in some circumstances, just putting a snare on the bottom jaw just to help to pull a head that's twisted around back up can be helpful. But please don't pull a calf by its bottom jaw, because you will fracture that jaw. And so if you're putting a rope around the bottom jaw of the calf to try and pull the head up, that's fine, but don't pull the calf out by that bottom jaw. I tend, to pull my personal use. I personally use a calving pulley in my car, just simply because I don't have enough room to carry a jack. On farm, I know that most farms have a calving jack on site, and I have no problem people using them, providing they use them properly, which is where you pull on the strain and then you use the fulcrum or the pull of the pulley, rather than trying to just simply skull drag the calf out. Now, there are circumstances where simply jacking the calf out is required, especially if the cow goes down while you're doing the delivery. And if you're pulling a calf that's looking like it might hip lock, you definitely do need to jack some of those quite firmly. But mainly, I like to work with the cow. I like to actually, as the cow strains, I'll take up the strain on the thing. As she pushes, I'll ease down on the calving pulley, or I'll lean down on my calving ropes just to try and help that sort of labouring process. I can't emphasise this enough. From the point of view of animal welfare, I don't believe that using things like quad bikes, tractors, utes, I've seen people with bloody boat winches, pulling calves out with that. It is not appropriate to do that. Please don't do it. It's not something as an industry we should be allowing, and it's certainly not good OH&S, for us as operators as well. And so, if you're going to use traction, calving jacks, calving pulleys, or just handles and humans is the way to go. In a normally presented calf coming forwards, if the calf doesn't want to pull out by pulling on both front legs at the same time, you can actually alternate pulling on each leg just to try and sort of crawl the calf out. And here's a good picture of it, where we've got like a calf here that if you pull this leg first, the right leg, it'll advance that shoulder and help to deliver that shoulder, and it narrows the actual thickness of the calf as it's being pulled through the pelvis. And then once you've got one shoulder through, you alternate and you pull on the other leg till you can walk that other shoulder through. And by just gently like alternating that traction, you can slip the shoulders through and deliver quite a firm calf without actually doing any damage to the cow or the calf. And then once you get the calf sort of to the point where the shoulders are through, you can then, at that point, once you've got the shoulders through, what we do then is we actually rotate the calf sort of 45 to 90 degrees. So what we're doing is we're twisting the calf just a little, because what we want to do is we want to present the narrowest part of the calf's pelvis to the widest part of the cow's pelvis. So in the picture here, you can see pulling it straight forward, you've got a bit of an overlap there. It might not fit. If we look at the other one, by rotating that calf, you actually allow the calf to sort of walk its way out of the cow. Oops, I've got the little thing moving. So this is what I tell people. These are my rules. When to call the vet. If she's been going for a while and you can't do it yourself, call the vet. If she's been going for a while and you get her in to check her and you can't find anything, you can't find legs, you can't find head, you can just feel a back or can't find anything at all, then call the vet. If you go to put your hand in the birth canal in a cow that's been up and down and straining, and it just doesn't seem to go anywhere, she could have a uterine torsion or a twisted uterus, and that is an emergency, and so she needs to be assessed. But general rule is that if you've been going for 20 minutes to try and deliver the calf and you've made no progress, it's time to sort of see if you can get somebody else to help you. And then the other thing that people will often call us for is if it's a really rotten dead calf, and we love those. Thanks for calling us to those. If the calf is really large and you just don't feel that there's the room, we've applied that test. You can't get the hand over the head or beside the head, and when you try to pull it up, the legs are crossed and you can't get it to progress sort of handspan past the flexible fetlock, then that calf might be one that needs some additional assistance. And so you might need to get somebody to help you out. This 20-minute rule is about being seen to make progress. And it doesn't have to be huge progress, just some progress. If you're pulling the calf, or you're trying to get a leg up, or you're trying to correct a head that's twisted back, and you're making progress, even if you haven't succeeded in 20 minutes, keep going. But if you've been doing the same thing for 20 minutes, either pulling or trying to get a front leg up, or trying to get a back leg untwisted, and you've made zero progress in 20 minutes, reconsider what your approach is. Maybe doing something different, maybe seeking some advice or assistance from someone who's got more experience, or even calling us as the vet is the way to go, because a dead calf has a terrible growth rate. And they make no money for anybody except the vets. And so if you've got a calf that's still alive and you're working on it but making no progress, that is the time to call while we still potentially can have a good outcome for cow and calf and farmer. So I think that if you follow this 20-minute rule, you won't have disasters. It doesn't mean you won't have difficult calvings, but if you've been pulling a calf for 3 hours and the cow's dry and it's abraded and damaged and bleeding, and the calf's now dead with a broken leg, calling the vet to those is a waste of your money and my time. And so what I would encourage you to do is to intervene to the level of your ability, seek assistance from somebody with more skill if you're not making no progress, and don't leave it until 5 minutes to dark, 4 hours of pulling to ring us, because at that point in time, we're much less likely to have a successful outcome. Now looking at how do we care for the newborn calf to maximise its chance of success. And what I look at here is what are the things we can do in those first moments after we deliver a calf that can help its viability. So the first one is position. How we position a calf after we pull it out is really important in how well it's going to be able to expand its lungs. Now, if I think back to the day when I was going through vet school, it was very common when you pull a calf out, people would want to hang them up on a gate. And I still see people do it all the time. And if you think about it logically, though, what does it do? Yes, it might help to drain some fluid from the lungs, but what it's doing when you're hanging a calf upside down is all the guts are falling forward onto the diaphragm, putting pressure on the diaphragm, which is stopping the lungs from being able to expand. If we get a calf and we sit him on his chest, we put the front legs sort of out so his elbows are out, and we put the back legs pulled forward so that the calf's sort of sitting like in this picture here. That's what we're trying to achieve. We want our calves to have elbows out, hind ribs under. This calf can expand both sides of its chest. If we leave the calf laying on its side, then one side of the chest can expand, but one side can't. And so you're going to end up with a calf that potentially ends up not able to easily fill both sides of its chest with air, and so it might not go as well. With our airway, We just want to make sure there's no mucus or no membranes covering across the nose or the nostrils, and clear the mouth out. And you can stimulate the calf by pinching their nose. You can put a little bit of water in their ear. You can put a little bit of a pinch over their windpipe so they'll cough and try and breathe. But I find mimicking what mum does, which is mum will lift that calf. So if we've got a nice, clean, dry towel and we can rough that calf up while we've got him sitting up on his sternum, just to stimulate that calf, it will allow the calf and make it want to breathe. And it allows us then to get the best possible expansion of the chest, and you know, what that is quite useful. We also want to make sure, if we can, that we don't let the calves just get cold, particularly if it's a freezing July day, blowing a gale, sleety rain. If we can, if we've pulled a calf out, if we can dry that calf off, provide it with some shelter, if necessary, put it under some heat lamps, or I've even seen people, when I lived in China, we used to dry their ears with a hairdryer, because it'd be minus 35 degrees, and if you didn't dry their ears, they would get frostbite on their ears and they'd fall off. So you can do some things like that to help to try and improve the viability of the calves going forwards. The other things that I love is, I really like these calf rugs for calves that have had a difficult birth and have maybe missed out on sort of having the best start to their life. It just helps them, because they're not having to use what body energy they've got to maintain their heat. They can actually use the energy that they've got for other purposes, including managing their own immune system. If we've pulled a calf out into a dirty set of yards, or the cows are calving in a calving pad that's dirty or contaminated, disinfecting the navel with either a strong iodine solution or a 2 to 4% chlorhex solution will help to reduce the risk of navel infections or joint infections. And I do think that that's a really, really useful thing. And I do think also, if we can, we make sure that they get colostrum and check all the calves for abnormalities, because if a calf has an abnormality, there's knowing about it early and being able to, potentially euthanize that calf so that it doesn't suffer is best practice. In a perfect world, we should record all calves as they're born, or as soon after we can, with a farm ID tag and or an NIS tag, and record that calving detail so we can match the calf to the cow. And that helps us later on, if we're going to do any analysis of survival, production, profitability, and those things are really quite beneficial. So if we see a calf like this with a cleft palate, it's usually kinder to euthanize that calf than to have it running around the place struggling and suffering. I've put this up. I don't expect anybody to remember it. There'll be no test at the end. But I like people to be able to identify what is normal. A normal calf will have a warm body temperature. They don't get below about 38.7 or 8. And if they're not at the right temperature, they will struggle. We want their heart rate to be nice and fast. Their respiratory rate is often quite fast when they're newborns. And I like to examine the tongue and the palate to make sure they've got no swelling or damage to the tongue, or cleft palate or damage in the mouth. And we want them to be responsive, because if they're just laying there dull, then that can indicate that they've got either a lack of oxygen, or it could indicate that they've got what's called acidosis and they could be struggling. So in a perfect birth, the calf will breathe within 30 seconds, try and lift their head up and respond to stimulus within 1 to 2 minutes. They'll try and sit themselves up onto their chest themselves if we haven't sat them up for them within 2 minutes, and try and stand within 15. We want them producing their own body heat by shivering within 30 minutes, to be up on their feet within 1 hour and sucking from that cow within 2 hours. And if we see these normal behaviours, we can be pretty confident that calf has got a good prognosis to survive. If the calf, especially if they're not shivering and trying to get up within 30 minutes to 1 hour, that calf needs a little bit of our help. And warming that calf will make a big difference to its survivability. So I would encourage you to consider that. Particularly if you've got a cow that's sick, after calving, she's retained the membranes or she's got an infection post-calving, she's had a difficult delivery and she might have a bit of paralysis or injury, seek advice early, particularly things like anti-inflammatories in those fresh cows. The earlier that they get them, the better they'll be. It's like if you take Panadol after you've had a headache for 2 days, it never works. But if you take it at the first sign of a headache, it works quite well. Cows are no different. Those anti-inflammatories work by blocking that inflammatory process. And if we wait until the inflammation is well evolved, then we're wasting our time giving them anti-inflammatories. So treat them effectively and treat them early. I do think it's important that we have some treatment plans or protocols for how we're going to manage those diseases that happen around calving, things like milk fever, calving paralysis, retained afterbirth, or dirty infected cows. Mastitis is a real issue, particularly if the calves are a little bit slow to get up and suckle, or if the cow has been leaking milk pre-calving and your calving environment is dirty. You can end up with quite serious mastitis, even in our beef cows. And so looking for things like a quarter they're not feeding off, abnormal swelling, heat or discoloration of the udder. They're all things that you want to look for in these fresh cows to give them the best chance of having a successful transition. This is, again, a poster that hasn't come across well to a slide, but critical calf care, I think there's 6 things that we like to sort of keep in mind. We like to isolate sick ones, remove them from the mob if you've got a sick calf scouring and unwell, because we don't want it to spread to others. We want to rehydrate those calves because electrolytes are the key to managing dehydrated calves, and many more calves die of dehydration than die of infection. Trust me on that. We want to treat them specifically for what they've got if we know what the diagnosis is, because that if we've got a specific treatment plan or protocol, and if we record what we've treated the calves with and what the outcomes are, we can make good decisions going forwards. We want to protect the calves from themselves, really. We want to make sure they've got a nice, warm, dry environment to maintain their body temperature. And we want to keep an eye on them, because if a sick calf is slightly unwell today and scouring and not quite himself, but we ignore it, by tomorrow that calf can be the one that's collapsed on the ground, seriously dehydrated and looking like it's going to die. I use what we call an eyes, ears, nose, tail protocol for calves. And it's so easy for you to do even as you're either walking through or driving through the paddock. You look at their ears. Look at their eyes. Are they bright? Are their eyes sunken or are they dull? If their eyes are bright and they're not sunken, that's a good sign. We look at their ears. Are their ears up or alert? That's great. If their ears are floppy and they're down, that's a bad sign. We look at their nose. If it's crusty or snotty, that's a bad sign, and we'd be worried about their nose. And we look at their tail. Is it covered in manure? Is it wet and dirty, or is it dry and clean? So if we're driving through a paddock of calves and we're looking at eyes, ears, nose, and tail, and the calf's up, suckling from mum, dry tail, ears up, bright eyes, those calves are going to be okay. But if you see a calf that's a little bit off to the side, maybe not, bright in the eyes, sunken, floppy ears, dirty tail, snotty nose, they're the ones we need to get in. And we do need to support those sick calves if you see them. We've got a down cow decision tree, and I think this is a really useful piece of equipment, just for people to have on their farm, just to help you make good decisions quickly. If the cow's bright, you follow the one path. If she's dull, you follow a different path. If she's not calved but is calving, then you observe her for calving, and if she's not progressing, you seek a vet. If she's not calving but she's but you can sort of just push her over and she gets back on her feet, she might have just simply got herself cast. If she's calved recently, she might have something like milk fever, and so we need to assess her carefully. But if she's dull and sick looking, she could have something as serious as toxic mastitis. And so we know that by following a fairly simple decision tree, even people that are relatively inexperienced at managing calving or sick cows around calving can make good sound decisions. And so if anybody wants to get a copy of that, just let me know and I should be able to forward it to you as a PDF. I think we sell them as well. But I think that's a really useful piece of equipment to have on the farm just to help you to make good decisions. And so if you've managed to successfully transition the cow through to calving, you've delivered a live calf, you really only just started the journey. And so pat yourself on the back and say, great job, you've got the calf on the ground, the calf's alive, hopefully it's got up and suckled from mum and got some good colostrum. But I do think that talking to your vets, your nutritionists, your advisors to help you with young stock management plans, particularly things like vaccination, how you're going to feed them, how you're going to provide parasite control, benchmarking their growth so that they are going to be well-grown 2-year-olds that are going to have a calf at 85, 90, 95% of their mature body weight, and making sure that we do those things throughout the life cycle of the calf. There's another whole lecture series that we could do on managing the young stock, but I do think that that's just the culmination of the journey, whereas the calving is the beginning. I also think that talking to people or seeking advice or knowledge to ensure that the cows successfully rebreed and remain a productive herd member for years and years is so valuable, because as we talk about things like emissions and efficiency and productivity and profit, all of those things are improved and enhanced by having cows that have longevity, cows that come in as well-grown 2-year-olds, calve early, calve easily, rebreed, and come back in as a 3-year-old and a 4-year-old and a 5-year-old. Those cows, their rearing costs and their rearing emissions are diluted by the more calves that they have, and so they become more profitable cows. And so even though you might think that what we're focusing on today is just simply the process of calving, it is the beginning of the journey, and for both the calf and the cow. And so I encourage you to engage with that and seek advice if necessary. And with that, I think I'm done. I nearly got through it in an hour. It took me an hour and 1 minute, and so I had a lot to get through, a lot to cover. I didn't know if I'd get there, but I managed to do it. And so now I'd open it up to questions. I'd love to answer any questions that people have got if I can.
Thanks, Rob. Perfect timing.
Yeah.
Now you did well to get through all that. Lots of helpful and practical tips and information there to digest. So yeah, if anyone has any questions, we've got a bit of time now for a Q&A. At the bottom of your screen, you should see a Q&A button. Just pop your question in there and I'll ask Rob for you. Just to kick us off, would you recommend feeding salt in a pre-calving diet to reduce the chance of milk fever?
Short answer, yes. If people have the facilities to be able to do that, absolutely. Look, in dairy cows, it's routine almost now to have some kind of lead feeding, that feeding around transition to manage milk fever risk. The thing about managing milk fever risk in non-dairy stock is that you've got to take a risk-based approach. And so if you're feeding animals that have really low incidence of milk fever, less than say 2%, then the cost and the effort of lead feeding with an anionic salt mix might not be worthwhile. But if you have high incidence of milk fever or subclinical milk fever causing issues around transition like retained afterbirths, dirty or infected cows, difficult or sluggish calvings where the cows are in good condition but just not wanting to push, then calcium could be the factor that's causing that. And so normally what I'd say, get some bloods done around calving time just to see if that's the cause of what the problem is. And if it is, anionic salts are a great method, providing you've got the ability to be able to feed them out, because you try and only give 2 to 3 kilos per cow per day in the 21 days pre-calving. If you've got no idea when a cow's going to calve because you've got no breeding records, no preg test records, guessing when she's going to calve within the next 2 to 3 weeks can be quite challenging, because if she's only on the lead feed for 4 or 5 days before she calves, it's not enough. If she's on it for 30 days, it's too much. And so again, the Goldilocks just right is the important part.
Very good, thank you. And just so everyone knows, yes, we'll provide the slides after. We'll send those out, as well as this has all been recorded, so will be available after the webinar. Another question is, on your first slide, you mentioned low potassium hay. Why was this? What was your...
That's a great question. The reason why we recommend low potassium hay for transitioning cows around the point of calving, is because of the same reason why we feed anionic salts to cows. It's around what we call the DCAD equation, dietary cation anion difference. And so potassium being a K plus has plus things, and so we want negatives to try and mobilize calcium. So high potassium forages, particularly would be hays that have been grown on either paddocks that have had effluent applied to them, or paddocks that have had like a lot of high stocking density. Those hays can increase the risk of milk fever. So we encourage people to feed tested low potassium forages to their transition cows if they're able to. It's one of the reasons why in dairy cows we tend to restrict their access to grass, provide them with, say, oat and hay, and a lead feed mix. In beef cattle, you might instead decide to just supplement them with a cereal hay, or a hay that is low potassium.
Right. And another hay question. If a cow's been on hay leading up to calving, how long after calving can she go on to pasture in addition to hay?
Well, that's a really good question. If she's only been getting hay and her rumen will be adapted to hay, going on to pasture will take 2 to 3 weeks for her rumen to readapt to having access to grass, green grass. And same goes for if you're adding grain or whatever. The rumen takes usually around that 2 to 3 weeks to adapt to a new diet. So if you've only been feeding hay, if there's been no grass in the diet at all, you should still provide a little bit of hay just for those first couple of weeks after calving, just so that you allow them to get that rumen to adapt well. And it also helps to prevent some of the metabolic challenges that can happen with a rapid change of diet. And as I said, it goes the same whether it be hay, grain, whatever. Adjusting the diet abruptly is never an ideal idea.
Yeah, great. We've got a few questions coming through now. Could you just expand a bit on what are colostral vaccines?
Sure. So there are vaccines that we give to the cow that she produces the antibodies, and then those antibodies go into the colostrum. And so an example of that would be a vaccine called, say, Scour Shield, which we inject into the cow or the heifer pre-calving, so that she produces specific antibodies to, say, rotavirus, coronavirus, E. coli. And so then when the calf drinks that colostrum in its first 12 to 24 hours of its life, it is able to absorb those antibodies directly into its gut directly into its bloodstream from the gut. And then those antibodies are actually active in the calf. So we're able to protect the calf from, say, a viral infection at 4 weeks old by vaccinating the cow pre-calving to make sure that the colostrum that she produces has high levels of those specific antibodies. And so I do think that that's a really good strategy if you've got a diagnosed problem for which you can vaccinate for. Another example of a thing that we vaccinate the cows for would be some of the salmonella strains. We'll vaccinate the cows to provide colostrum protection for the calves in that critical 3 or 4 weeks before they're capable of mounting a good immune response of their own.
And in southern Victoria, what months are desired times to have grass tetany blocks out?
The risk for grass tetany is, generally speaking, associated with rapidly growing, short, lush seed. So normally I would say springtime, but we're also seeing autumn, particularly with some of the more improved, high quality ryegrass pastures. If they're really newly established, short, lush, rapidly growing pastures, they can be conducive to grass tetany. So putting out some blocks, providing magnesium oxide as either a supplement of feed additive, spraying it on some pasture or hay, whatever, providing a source of magnesium in periods of high risk. And so that would be any time where you've got short, lush, rapidly growing pastures would be my suggestion.
Great. And if you've got a new calf which is only sucking the 2 front teats, can the cow get mastitis? And what does this look like?
Sure, she can, because one of the things that protects a cow from mastitis is the flushing effect of being milked out. So if the calf is only sucking the front 2 teats, it may be that the back teats are too big. It might be that there's, that they're struggling to get the milk out of those teats for whatever reason. The risk is increased that they will develop mastitis in those two back teats that they're not suckling from. What does mastitis look like? We define mastitis in dairy cows as abnormal milk that persists beyond 3 strips. So if you squirt the milk out and it's got a few clots or a bit of bloody or a bit abnormal, and you do that 1, 2, 3, 4 squirts and it's still abnormal, we look at that and say, okay, that's abnormal. That's what we could define as mastitis. In beef cows, we usually identify it because the quarter is swollen, hard, or hot, and the calf is not feeding from it. And if a cow has mastitis, and the calf's not feeding from that quarter and the cow becomes unwell, we do need to get her in and try and get that infected milk out of the quarter and treat either the quarter or treat the cow with injections of antibiotics and anti-inflammatories to manage that mastitis problem.
Yep. And mastitis is probably a whole new topic to talk about.
Yeah, exactly.
Yep. If a dairy cow is seen to be leaking colostrum, should that colostrum be collected or leave it?
Yeah, that's a question that I normally would say to people. If you've observed a cow leaking colostrum, the likelihood is that her colostrum won't be high quality. That doesn't mean necessarily that it won't be. And so what I would do is I would get that cow in and I would milk her within as soon as you could after she's calved, ideally within 12 hours of her calving, and using a refractometer, which is a little device that we can put a drop of milk on, you look through, and we measure the concentration of solids in that milk, and we use it's called a Brix refractometer. And if the Brix reading is over 22, then we would definitely use that colostrum. If I have a Brix refractometer and it's less than 22, I wouldn't necessarily use that colostrum as first milking colostrum, like first feed colostrum to a 2 or 3, 4 hour calf. But what I definitely would do is still use that colostrum as food. It's excellent food. So I would still definitely continue to use that colostrum, but just not necessarily as a first feed. But then I also tell people the best colostrum you've got is the best colostrum you've got. So if that's all you've got, use that. And so general rule, it's less likely to be high quality, but doesn't guarantee to be like high quality, low quality. I mean, just because she's leaked. And if you've got a lot of cows or heifers leaking their colostrum, considering use of a teat sealant in dairy animals is a great idea because it will help to prevent that.
Very good, thanks. Can you give some advice regarding pestivirus prevention during joining, particularly?
How long is it? That in itself is another full conversation, but my general advice for the pestivirus is that in a perfect world, we have a herd that have got no persistently infected animals that are immune. So we can screen the herd for PIs by ear notching, and in a dairy herd, we can also monitor the VAT. In young stock, we can collect some blood samples from a group of animals, maybe only 6 or 8 from the group prior to them actually being joined for the first time. And if they're immune, then we know they've been previously exposed, but they are immune. If they are not immune, they should be vaccinated. So in a perfect world, no animal being joined for her first time should be naive or not immune to pestivirus. So either she should have been previously exposed, which is not ideal, but she'll be immune, or not exposed and vaccinated. So that's in a 5 sentences. That's as quick as I can be on pesty. We want them to be PI free and immune prior to joining. That is the perfect scenario.
Yep.
But a long to have to really tease that one out.
Yeah. Yeah. And if you need more information, just get in touch with us and we'll
Absolutely
get Rob to give you some more info. A few more questions. My new calf had fetlock knuckling. Is it better to leave it or to splint it?
So my rule on fetlock knuckling is that if the calf can get on its tippy toes, and so it's not knuckled right over on its fetlock, usually they will get back on their feet and they won't need to be splintered. But, this is the but, if they're knuckling over or if they're damaging the front surface of their fetlocks because they're dragging or walking on them, or they're not able to achieve that tippy toe stance, definitely it's worth getting somebody to look at them. We would usually give them IV Oxytet because for whatever reason it helps to stretch out the tendons, and we'll put either a cast or a splint on those fetlocks, those feet, to try and extend the fetlocks. And the aim for splinting them is to try and get, as I said, at least to the point where their tips of their toes are touching, so that they can actually start to stretch out and support those ligaments and start to weight bear, because normal weight bearing on their toes is the best thing you can do to get those to stretch out the way we want them to.
Right. And could you elaborate on RFMs and how long to leave before intervening?
You know, I work on the I think it's called Show Dairy Love Facebook page, and I saw the other day that somebody put a post on there about it, and I was absolutely horrified, and I nearly bit my tongue off because I was going to comment, but I didn't. I should have. The advice that people give around RFMs is appalling in general. So this is the advice. If a cow has a retained afterbirth, do nothing unless she's unwell. If you want to trim it off, it's a good idea to do so. And I normally trim it off about 1 hand span below the vulva, just so that it's not hanging out. The reason why people say tie rocks to it, put a boot on it, I've heard all sorts of stories of what you should do and shouldn't do. The reason why you don't want that afterbirth just hanging out there in the dirt when they lay down, if you ever watch a cow with dirty afterbirth, she lays down in the dirt, it flops out in the dirt. She might poo on it, and then she stands up and it goes back into the cow. So that afterbirth can act like a wick to draw bacteria and muck into the reproductive canal. So trimming it off is a good thing, but leave it alone. If you try and pull on it before it's ready to go, you will damage the maternal caruncles. So you've got the cotyledons from the calf and the caruncle from the cow, and that's kind of what the placenta is attached to inside. Years ago, we used to believe that the process was a physical process where the uterus contracted up and sort of they were squished off. What we now know is that it's an active immune response. So the immune system actively is rejecting the membranes and getting rid of them. So if you're getting a lot of cows with retained afterbirth, RFMs, it tells me that you have issues with your immune system of your cows. So if you're getting more than, say, 2 to 4% RFMs, you need to have a good hard look at your minerals and your nutrition and why, and ask yourself, why are these cows immunosuppressed and not cleaning the way they should? So you've got to the point, you've trimmed the membranes off, you've not left them hanging out in the dirt and the shit to sort of cause problems. You leave them for, say, 5 to 7 days. And if you want to have a gentle tug, well, maybe. I'm not going to fight you if you want to give them a gentle pull at 5 to 7 days. But what you really want to do is you want to monitor that cow. And if she becomes unwell at any stage, she gets a course of antibiotics and a shot of anti-inflammatories so that she feels better. And the reason why she becomes unwell is because the infection goes from being inside the uterus and quite safe to, if she gets a temperature and becomes off color, it means that the infection spread into her system and she needs antibiotics. So leave the membranes alone. If you want to cut them off, please consider doing that. Antibiotics only if she's sick, and that usually will be indicated by her running a temperature, which is again the reason why I say it's a good idea to have a thermometer. And when you do treat her thoroughly. Give her antibiotics, anti-inflammatories. Because she's a fresh cow, she's probably in a negative energy balance. So you might want to also consider giving her some fresh cow drench or some ketol acid X, whatever you want to call it, just to make her energy levels up. A shot of, maybe something like some AD&E to try and help, boost her immune system. All those things are going to be beneficial.
Okay, thank you. Is there a particular age you should retire a cow from breeding?
That's a good question.
I guess it really depends, doesn't it?
It really does depend on how sound she is. I think the key thing to keep an eye on with older cows is their mouth. If a cow ends up broken in the mouth, so her teeth are really damaged, she's not able to graze, she will reach a point where she's not able to support herself and a pregnancy and a lactation. And so often the decision is made by the cow herself, but she just stops being productive and ends up culled for that reason. I've had cows of my own that lived through to their early 20s. They usually stopped producing calves in their mid to late teens. That's only anecdotal. It's my own personal experience. I don't think there's an absolute time where you should stop breeding a cow if she's sound, cycling, got a good mouth, and in good body condition and recovering from one calving to the next. She can remain as a productive member of the herd. But if she starts to fail, if she's got a broken mouth, where her teeth are starting to fall out because of age, you've got to do the kind thing, put her out of the misery. Put her on the truck.
This question, they're first timers on a small scale, 7 cows, 40 acres. Is there any particular reading resources that you can recommend to them? They're going to see their local vet in a couple of weeks, but they just want to be prepared.
Yeah, specifically, I don't actually know like a particularly good reference that I can give you, but there are some fantastic resources on the internet. There's just joining us tonight, and building a network of people that you can communicate with around things, I think is important. Sorry, I just can't give you a recommendation of a book offhand. We used to, when I was a young lad, Hungerford's Diseases of Livestock was our Bible, but that didn't really tell you much about management of stock, but more about what went wrong with them. And so, yeah, sorry about that. I can't answer that question.
Yep. What do you recommend for vaccination to prevent viral calf scours?
Yeah, I normally recommend RotaVec or Scour Shield. There's 2 vaccines that are targeting rotavirus, coronavirus, E. coli. The Scour Shield one I like because it's simple to use and you don't have to use all the bottle at once. So I find that works well for people that are doing 2 doses 6 weeks apart that aren't going to use a full bottle. The RotaVec I really like because it also does some of the other Clostridium perfringens type A, and so you can actually get some benefits from that if you had that problem. 6 of one, half a dozen the other. But they're the 2 vaccines that I recommend for viral scours, which is so it's Scour Shield or RotaVec.
Yeah. There's a question around home remedy treatments for ringworm. Do you recommend you let ringworm run its course with no treatment if it's not too severe?
Yeah. Again, if you've got a cow that's got a little bit of ringworm, or a heifer particularly, it's not that uncommon for them to get a little bit of ringworm. And so long as they've got a competent immune system, they usually will get over it. I like, if you're getting a few cases of it, I like to make sure that there's no immunosuppressive events going on that's contributing to it. And that might be screening for some pestivirus, looking at nutrition, etc., etc. As far as treatments go, you can scrub the treatment, you can scrub the lesions with iodine, that will work. You can use antifungal ointments or sprays, they will work. The economics of it, that said, I talked earlier about zoonoses, diseases we can catch from our animals. Ringworm is one of those. And so if you've got children, immunocompromised, immunosuppressed people, they will also potentially catch that ringworm. So you might be more inclined to treat them if they're in either close contact with people or whatever. And so my sort of go-to is either iodine or one of the various antifungal treatments. There's or one's called fungicide cream. You get them from the vets. They are, I think, I'm not sure if they're prescription or not offhand, but we do have them at the clinic.
Okay. And can you comment on feeding low potassium hay to heifers prior to calving to minimise the lazy heifer calving problem?
Lazy heifers can be caused by, same as lazy cows, low calcium. So low potassium hay may help to improve that. It's the reason why they're not progressing in their labour is because their blood calcium levels are low. Then that would be a really good strategy to try and help to reduce the risk of lazy calvers.
Yep. Okay. Couple more questions. Can some plants or trees cause a cow to abort, particularly cypress trees?
I believe that cypress and some of the pine trees can be abortogenic, but I think they probably get blamed for a lot of abortions that they're not responsible for. The challenge we always have with abortions is identifying the agent. Neospora is a common one, but there's a whole bunch of things that can cause abortions. So would I put my springing animals in a paddock filled with cypress and pine trees? Probably not. Do I think that it's a common cause of abortion? I think my jury's out on that. I do think it probably gets blamed for a lot more than it's responsible for.
And when checking calf the temperature, would a forehead thermometer work, or do you use the rectal?
No, I use a rectal thermometer. I don't know that the forehead thermometers have been validated in cattle. Same as the ear ones. I don't think they've been validated in cattle either. I tend to just stick to a rectal thermometer. You can just again, going back years, we used to use just the ones with the mercury in them, but now the digital thermometers are just so much more robust and so much safer to use on farm. You can buy them really cheaply. You can get better ones than just the really short ones. Like you can get extra long ones for use in livestock, and they probably are worth the extra few dollars, just simply because you don't want to just take the temperature of the air inside the anus. You want to actually get a core temperature, which requires it to be, inside the animal. And the other thing, I'm telling you how to take a temperature is to push the thermometer in. And actually, I try and angle it so that it's pressing against the mucosa of the rectum, so that you've got a good contact to actually, as I say, we're wanting to try and get the temperature of the calf of the core rather than just simply what's its anus. So in as far as you can, touch it against the side of the body of the rectum. Don't push it through, whatever you do, but just gently hold it there and read the temperature. We want it to be, for a calf that's over say 39.2, I would consider that to be too high. And a calf that's less than about 38.2, I would consider that to be about too low.
And I might make this the last question, just in looking at the time, but is it beneficial to add yogurt to milk for scouring and sick hand-raised calves?
Is it beneficial? I'll say maybe, because probiotics or good bacteria do have some benefits in animals, and one of the advantages of adding, say, a natural yogurt to milk that you're feeding the calves is that, especially if you're using it to sour the milk. So in other words, we would add the yogurt and then mix the milk and allow that milk to sort of go through a process where you end up with the acid from the yogurt acts as basically a preservative of the milk, and it can stop nasty pathogens, nasty bacteria from being able to grow in that milk. So from that perspective, I really like the use of yogurt. Is the number of probiotics that a calf is likely to get from a feed of yogurt to be significant enough to make a huge difference? maybe not. There are some high CFU or high colony probiotics that are shown to be of benefit in sick and scouring calves, and so I don't think that they're the treatment by any stretch. Will they fix a problem? Probably not. Will they maybe help a problem? Possibly. Well, I'm a little bit on the fence as far as whether it actually is a significant improvement. I think if you ask me what my veterinary advice would be, it's try and make a diagnosis as to why they're sick. If you can prevent it, prevent it. If you can treat it specifically for what it's causing the problem. And all of the other magic additives, all the foo-foo dusts and the probiotics and the extra bits and bobs that they help, but I don't think that any of them on their own will fix a scour's problem. I think calories and cleanliness and colostrum, they're the things that make calves healthy.
Great. Well, thanks, Rob, for that. It's been very informative. Sorry if we didn't get to your questions, but if you want to email us through, we'll pass that on to Rob. There will be a post webinar survey which will be sent out to you, and it should pop up when I end the webinar as well. We'd greatly appreciate it if you could fill that out for us. It really helps us guide the project and what topics we cover at these events. So thanks again, Rob, and hope everyone has a good night.
My pleasure. Thank you, everybody, for joining and sticking with us.
Okay.